ukuthi uMalaria phecelezi malaria. Kanti namhlanje angihambi ngedwa, ngihamba nodokotela Makhosazana Dlamini ozobe echaza kabanzi ngesifo semalaria. Ngikwamukele Dr. Dlamini.
Ngiyabonga Dr. Prue.
Uma ungabe umchazele umbukelo osekhaya ukuthi ubani uDr. Makhosazana Dlamini.
Dr. Makhosazana Dlamini udokotela lo osebenzela eMpumalanga eIvenda. Ngokutalwa vele ngumuntu waseMpumalanga, dalelwe eManzana, currently known as Manzana, previously known as Baplas. Ngikhulele eMpumalanga, ngafunze eSifako Mahato, then used to be Medunsa. Currently ngisebenza as a general practitioner and a travel medicine provider based eIvenda next to Sekunda.
Kanti abasamkhumbulayo sike saba naye la endlini sichaza yona indaba yama vaccination yabantu abavakashela kwamanye amazwe. Kepha namhlanje simbizile futhi uDr. Dlamini ukuthi azosichazela kabanzi ngaso isifo lesi sakaMalaria. Kepha ngaphambi kokuba siye lapho dokotela, kukhona izifo lesi sisibiza ukuthi ama-non vaccine kepha preventable diseases. La ungathi uma uvakashela kwamanye ama-countries uzithole ngabe iziphi lezo zifo lezo?
Yes, dikhona tifo leti lesingakhona ukutivikela letingadzingi necessarily vaccine. Letiningi lento tichaza titholakala khona sub-Saharan Africa which is parts yemhlaba lehlukumeta thina kakhulu. Letitayelekile ngaphandle kwalesi sitokhuluma ngayo lenkulu topic sitokhuluma nge-schistosomiasis, ibilharzia. Ibilharzia isifo lesijwayelekile South Africa futhi sikhona kakhulu. Bantwana labaningi basithola basakhula, umuntu masakamdala ahlushwe indzaba yokuchama umchamo lonengadi. Ikhona eSouth Africa, but we will not necessarily say ukuthi South Africa is endemic with the schistosomiasis. Schistosomiasis or ibilharzia phecelezi ikhona kakhulu West Africa nase East Africa, ikhona Nigeria, Ghana. We also have it in our neighboring country Mozambique, ikhona futhi nase Kenya and Tanzania, and DRC. And then we also have the Hunter virus, which ikhona DRC nase Sierra Leone. Lama viruses lesikhuluma ngawo lekugula lesikhuluma ngako manje ukugula lokhu affecta kakhulu in relation to travel. Ngiyathi ukuthi awareness in general nemuntu loma travel, but in relation to travel medicine siyati highlight kakhulu. Kube khona ilona Crimean Congo hemorrhagic fever, lekhona DRC, ibe khona in certain parts of West Africa, ikhona futhi na certain parts of East Africa. And then kube khona futhi Zika virus. Zika virus of interest, there was an outbreak I think around 2010 around the Soccer World Cup. It was found in Brazil. And then bese kuba khona there's quite a lot. Lamaningi, I guess you can check them go CDC or check them go South African Society of Travel Medicine, which is a local source for all these related diseases.
Okay. Dokotela, namhlanje sikhuluma ngesifo sikaMalaria. Bangakanani abantu mhlambe aba infected ngesifo sikaMalaria noma uthola ukuthi bashonile ngesifo sikaMalaria?
Yeah, Malaria or malaria commonly known sifo lesi lokubuhlungu ukuthi sifo lesi umhlaba sokuyahluleka ukusicontrol. Dzala sikhona, and I think lokunye ngema-pandemic lamanye lavelile and ukuthi awareness ye-malaria abantu bangayithatheli etulu, kodwa sifo lesibaluleke kakhulu ngoba sibulala quite a lot of people. Statistics sithi kukhona i-statistics esipublishiwe ukuthi between 1980 and 2020 bantu lababulawa ngemalaria on average about 1.8 million. And that is a lot, considering ukuthi sifo lesikwati kusivikela nasingakhona ukusivikela njengoba sitodiscussa kabanzi namuhla. Lokunye futhi sifo lesingasheshe sisidiagnose kahle kahle, sifo lesithutheka kalula lesingavikeleka, but unfortunately nasingakatholakali early or sisimisile then siya compromise singakwenda ukuthi umuntu agcina luza impilo yakhe. But on average bantu laba bulawa malaria every year there are more than 600 plus or minus 600,000. That is a lot.
Baningi laba bantu. Kanti kahle masikhuluma malaria isifo esinjani singena kanjani futhi?
Malaria sifo lesibalekile in terms of travel because sifo le research ithi malaria is the commonest cause of death among travelers kuma tropical and subtropical parts of the world. Sifo lesikhozwa i-parasite. I-parasite they belong to the family of Plasmodium. Plasmodium species maningi kukhona i-Plasmodium malaria, Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum, and the Plasmodium falciparum becomes the one of interest because it's the one the more dangerous, it's the one that leads to more death, it's the one that dominates kakhulu in sub-Saharan Africa.
Okay, so maseyihlumile lo mosquito kungathatha isikhathi esingakanani ukuthi ukhombise impawu kanti iziphi lezo impawu futhi ungazibona ngokushesha?
Malaria umuntu ithola njani? Ithola ngokuthi alunywe i-mosquito le vector i-carrier kahle kahle yale virus. I-mosquito i-carrier ye-parasite absorbing virus. I-mosquito isebenza ukuthi ithathe the eggs of the parasite from kahle parasite maqanza wakhona atholakala endaweni lemandi, hence vele mosquito atholakala lapho kumandi khona lapho kunemfula khona lapho belina. Then mosquito ithi nayithatha those eggs bese nayi-infect umuntu ba infected, but it's part of the cycle yale parasite ichubekela phakathi emtimbeni womuntu. And unfortunately it's hence ibida uthi parasite, in a parasitic relationship yona isuke ichubeka normally ku cycle yayo, but unfortunately yenda i-compromise impilo yomuntu. So ma symptoms, the onset of symptoms ayifani, kuyadependa. You've got umuntu lo sheshe a present quite soon. No umuntu after mosquito imlumile, they can present within a period of few days. Then no umuntu can actually take a long time. Hence sithi now udila ngemuntu lo suspect ukuthi unemalaria kubalekile ukuthi umude ukuthi uke wahamba na. Because lo umuntu angakhanza ukuthi ma signs we malaria, ma symptoms ke malaria ahlukile. Akhona la lesithi ma non-specific symptoms. La into ukuthi dokotela nakakubona angasuke angacabanga ukuthi malaria, especially nongeke uzumnikede i-history ukuthi wena bohambile. Umuntu angashisa, angaphathwa inhloko, angafuna kuhlanda, angachachatela benama-rigors and chills, and then lamayela angaba ne-diarrhea and vomiting. Lo munye umuntu angaba nama-specific symptoms ukhanze ukuthi uba ne-jaundice. Lo munye umuntu ke angaba bese uba nema-seizures, abe nema-fits, or you can even slip into a coma. That's a complicated into lesibita ukuthi cerebral malaria. So my symptoms are ahlukile, but the commonest one usually kuba your fever, shisa nokuvamakathi. Abantu abaningi bayiconfuse ngazo ukuthi bangenwa yi-flu. Lawo ma symptoms moshi uma ilunywe malaria njengoba sisho ukuthi it can last from few days to it depends. Nokuthi njenga for example, I think i-Plasmodium vivax ithatha isikhathi ukuthi ma symptoms are present.
Okay. Kukhona ukuthi mhlawumbe umuntu azazi ukuthi ubevakashile then uyabuya unalempawu lezi and then aye eclinic. Uliphi usizo kufanele aluthole eclinic ngokushesha ngaphambi kokuthi mhlawumbe aza complicate agciniseka esibhedlela? Uliphi usizo kufanele abonesi bampe wona, especially kuma clinic lapho ukuthi akude udokotela kude ama specialist?
Yes. For umuntu bekavakashile ngoba vele at the end of the day malaria is so common. And they are seeing access to a travel clinic for consultation. If bohambile uyenza wenile, meaning believe ukuthi konke kucala nge-responsibilities. Phila i-country where se highlight amalungelo more than my responsibility. Now tosuke South Africa malaria, uye enzaweni lene-malaria like Mozambique, ngithatha ukuthi research you will have done, not necessarily research but lwati. Nebantu laba bazokuxwayisa ukuthi thatha kulepisonke into kube nemalaria. So no ubuya uyathi ukuthi bowuvakashile. Once waqala uva ngathi ungenwa i-flu sheshe uye eclinic kubalekile. Once kwavela ama symptoms kufanele usheshe uye eclinic bachazele ukuthi uva ngathi ungenwa umkhuhlane ngoba impawu yakhona ngathi cishe impawu emkhuhlane. And then ma clinic lamanye ukhanza ukuthi baba nayo rapid test. So akusukuthi ngoba labanye abantu don't have access to esibhedlela, labanye ama-clinic la remote, so it's advisable ukuthi babe nayo i-rapid test malaria, so they can just quickly do i-rapid test malaria and then baqale i-medication malaria.
Okay. Manje uthi ukuthi nangoke umuntu uvakashile wherever kuleyo country lapho kutholakala khona ukuthi malaria, uyabuya uyahlala, uyayizwa headache mara ulokhu uthatha kancane. Ingagcina yenzeni la emtimbeni? Imaphi ama-complications mhlawumbe angaba nawo?
There's a lot. Ma-complications with malaria, I think the most serious one is cerebral malaria. Lokunye futhi you can have jaundice.
Uma sikhuluma nge-cerebral malaria, from umuntu osekhaya unga-understand lesilungu sabodokotela, ungamchaza ukuthi uthi yini nje i-cerebral malaria?
I-cerebral malaria sithi ukugula kwemalaria kusuke ku-affecta i-central nervous system yakho or iphathi yengqondo yakho. Usually siyibona ngokuthi umuntu abe nama-fits. Ngoba imalaria ingayenda ukuthi umuntu abe nashukela lo phansi, or part of the treatment ingenda shukela lube phansi. So sithi if usesi-excludile ukuthi ushukela bowungekho phansi, ufithile, ube nema-seizure, but ama-seizure sastopile mara soluku-coma awuvuki, le's a sign ukuthi sowune-cerebral malaria. And usually vele it has high mortality. Umuntu lo sophathwe i-cerebral malaria usually they don't make it. Okay. And so kubalulekile if ukuthi utohamba uyenzawo lene malaria, earliest symptoms, the development of symptoms, you must just go and get help.
Ngoba kahle ungalithola usizo ngisho eklinikhi,
ngisho naseklinikhi awudingi nokuthi uye esibhedlela.
Ngaphandle kwengqondo imaphi amanye ama-organs ala emzimbeni ayinga-affecta imalaria?
You can also have liver. You can have jaundice. Because why jaundice? Because part of his cycle, yale parasite nayingene engadini, nayingene emtimbeni, is also in the liver. So you can have jaundice. You can have anemia because part of the cycle yale parasite iguma red blood cells, so it destroys my red blood cells. So you can have anemia. You can have liver failure. You can have liver complications. You can have like hypoglycemia, sugar level pants. You can have, because malaria will cause diarrhea and vomiting, so you can be dehydrated, get into shock, complications.
Manje dokotela, ungaxwayisa uthini? Uthi is preventable, and hlala sisho ukuthi prevention is better than cure. Umuntu ozohamba awuvakasha, especially kulawo mazwe okwaziwa khona ukuthi kugcwele imalaria, yiziphi izinto afanele azenze before ahamba?
For South Africa, our neighbors, like Mozambique, it's one of the malaria endemic countries. Both Zimbabwe is one of the malaria endemic countries. Even certain parts of the country, like parts where there is areas that are endemic, parts of KZN, parts of Mpumalanga around the Kruger area, and parts of Mpumalanga as well. So look, you don't even have to leave the country. Yeah. You must just assess the risks. Now, one of the Vagasha, maybe it's or Gunama cases, or outbreaks, if you must do a little bit of research. But see, prevent malaria. Konalene sibita would say chemoprophylaxis. Kukhona ama-drugs, ma-pills, besiniketa wona la khona kuvikela malaria. So sibuyele ekutheni planning kubalulekile njengoba ngisho ukuthi mina I feel kukhona part of responsibility. My responsibility angisho sitoyipromote ngokuthi sende abantu babe aware. Hence kubaluleka kwale show lesikiyo manje. Ma-prophylaxis we-malaria, ngicela highlight nje is my experience as a doctor. I've had patients labafika bathi bantu bafuna i-shortcut. Umuntu ufika sekahamba kusasa, sekaphethe into la mngani wakhe, i-colleague la ithole emsebenzini, dokotela nginanaku ngicela ubhalele bani banikete kona. Lokuyini fanele baku-understand but kula maphilisi, ma-chemoprophylaxis, not everything is suitable for everyone. Yeah. So kubalulekile to plan consultation at least 6 to 8 weeks before. 6 to 8 weeks before you travel to assess what prophylaxis must you take. My prophylaxis with malaria la khona ayitrephela. I've had bantu bathi hayi mina bangijova ngicela umuntu ngomjova. There is no injection. There is no quick fix. There's 3 types of prophylaxis. Kukhona imefloquine or imefilium, which is one of the drugs, the malaria. Imefilium Currently, at the moment, it's controlled. I say easily available like it used to be. It used to be a very easy drug to take because at least 2 weeks before travel. I not say once a week. I not say every week. Malaria, so not for 4 weeks after. Unfortunately, in the past few years, we've all struggled as GPs to get mephelium. It is still the prophylaxis of choice for pregnant women. So if you are pregnant and traveling, mephelium is the drug of choice. And then you also have Malanil. Malanil it's one of the drugs that are prophylaxis for malaria. It's easy to take. It's the one I think commonly used because it's 2 days before. So Malanil you can take it 1 or 2 days before you travel. You take it once a day. Then you take it every day, malaria, and you continue to take it for 7 days after. And then basically the other one is doxycycline. Doxycycline, commonly it's an antibiotic, but it's used also as a prophylaxis for malaria. Doxy, if you take it a day or 2 before you travel, then you take it every day, but you're not if you 4 weeks. For 4 weeks, and it's a daily dose. And what are side effects with doxy? But we call patients where doxycycline it is the drug of choice for prophylaxis. For example, patients laba immunosuppressed, some ARVs. Some of the ARVs they interact with the Malanil, so they have to be on doxycycline as the prophylaxis of choice. So it's not a one magic wonder. Importance of planning, and this is so important. That's the complications of malaria. It's important to plan. It's important to take medication because prophylaxis is from developing malaria than to in a malaria endemic area.
Sikhuluma ngabantu base-Mozambique bahlala ku-area enemalaria. Bona basavava kanjani? Ngabe nabo bahlala baphuza lama-prophylaxis every day or bahlala kanjani bona bangabi infected?
For abantu base-Mozambique, kukhona i-concept ye-herd immunity. I-herd immunity kibo bayithola ngokuthi because i-infection ihlezi ikhona. So if you go adibana nebantu base-Mozambique, they tell you or nebantu basezim, they tell you malaria ifana ne-flu, the way igcwele ngakhona. So majority of the people there, it's not even a vaccine, they don't have to be vaccinated, but sebayithole enough for them to have immunity. So now uhlala khona une-immunity, hence ngobe abantu abaningi bane-immunity ayibaphathi. Nomuntu longanayo immunity uyavikeleka from the herd immunity because a certain percentage of the population has developed immunity. But immunity yakhona ayilast. Isikhathi lesidze, meaning if utophuma kuleyo country ungasahlali isikhathi lesidze, siba nabo laba mina njengami ngisebenza eSekhunda, ngihlala eSekhunda ngisebenza khona, which is a migrant town. So if abantu abahlala eSekhunda base-Mozambique, they take it for granted, and we always treat malaria whenever they come back home. Because they go home and they don't take prophylaxis. Some of them, I cannot say all, but they go home, they don't take prophylaxis. And it's so classical. Now we're back to malaria. And they could have prevented it.
So kusho ukuthi ingakubamba kayo kokuqala iphinde ikubambe futhi kwesi2 kwe3
ibambe futhi especially maso lose immunity ngiyakubamba. Now ungahlali khona ke vele ayi usenkingeni. It means every time you go there, you must take prophylaxis.
Ngithembe umlaleli lapha ekhaya ufunde kabanzi namhlanje ngesifo semalaria. Dokotela, njengodokotela osebenza ngabantu abavakashayo noma abavakashele eSouth Africa noma abaphumayo bovakasha, yiziphi ezinye izinto umuntu ofanele azenze ukuze mhlambe azivikele for imalaria lesi?
Yes, ngoba
ngaphandle kokuthatha amapilisi.
Yes, doctor, that's a very important one. I-malaria nasibuka ku-handlisha malaria or i-awareness nge-malaria. Sicala ngokuthi kokuqala before sinje kahle kahle sijampesa ku-stage 2 uma nge-chemoprophylaxis. Stage 1 is to avoid bites.
Uzoyi-avoida kanjani mosquito ngoba mosquito ahlala khona?
Is to avoid. I-malaria it caused by night biting mosquito compared to travel medicine as yellow fever and the other ones that bite you during the day. So you must avoid mosquito bites at night. How do you avoid it? Now traveler, so kuhambe Mozambique is not just to thola chemoprophylaxis. We also recommend that you have repellents the final apply. Now let try and get long sleeve things. Expose your limbs, get a net. Kukhona nets that are treated with this disinfectants, like with the repellent types, I think it's DEET. You get those nets that you use now, you apply repellents, you can carry your mosquito coils, but do everything at all costs to avoid uba bitten by mosquito before sitokhuluma prophylaxis. Because if you don't avoid uba bitten, then you're reducing your chances. But if mosquito gluma, at least when until prophylaxis. Then if mosquito glumilo until prophylaxis, when the prophylaxis does not guarantee 100% protection at the end of the day, then hence konke kuya responsibility. Abona responsibilities womlali umbukeli ukuthi anganani. Nase iglumile mosquito unathile amaphilisi. The first thing now you develop ama symptoms, you present yourself. Coming back to the issue of prevention, docs, it's a first, actions to take to avoid the gloomy mosquito at all costs, and then secondly, taking prophylaxis low when you depart, and then lastly, now develop symptoms which present patients should be informed. Mozambique automatically must go to the clinic. You seek help if symptoms develop.
Yeah.
We believe in the chemoprophylaxis. We also believe in the actions that you will have taken to prevent the bite.
I guess especially mild symptoms and severe symptoms so chances
if you develop severe symptoms.
Yes.
It depends. It depends. Mild symptoms, obviously malaria is caused by a parasite. You must get malaria treatment. Supportive therapy is not going to help you. As long as you get the proper meds, you're going to be fine. But if you go to 20 treatments late, then there will be complications, of course. Like cerebral malaria, it has a very high mortality rate.
Yes. But local
definitely treatable.
Okay.
Definitely treatable. It depends. Treatment of malaria is so simple. It's a 3-day course, you won't believe. Usually the drug of choice is Coartem. We give the medication over a period of 3 days, and then you are set to go. If you are severe, you are vomiting, obviously we prefer to give you IV. Quinine is one of the drugs that is given IV.
Sibonge kakhulu Dr. Dlamini. Ungathanda ukuthini kubantu namhlanje uhleli ekhaya? Ungadecide ukuthi kusasa ufuna ukuvakasha mhlawumbe Mozambique or wherever. Ungathini nje?
Umuntu ufuna ukuvakasha lokubalekile kuplan itrip yakhe. Ngoba now plan itrip njengase South Africa, we have the South African Society of Travel Medicine. It is a source that you can go internet, guide and often look for certain countries. Even not only SASTEM, you can go to CDC, who check in terms of my disease profile, and then you can go to a travel clinic or a medical service provider, the doc advisor in terms of vaccines that you must take, prophylaxis that you must take. Besides in malaria, one of the common diseases, but it was not infections per se, like a recognized infection, but it's a concept, sibita ukuthi travelers diarrhea, which is a common condition that affects our travelers. So planner your travel because you don't want to take things with as much as malaria, have mastered doses there and there, medication from developing travel diarrhea, take medication from developing malaria, carry your nets. You are prepared, but you must plan your travel at least 6 to 8 weeks before.
Okay. Dokotela njengoba sikutshontsha nje phela siyaqala ukuba nayo udokotela osebenza ngabantu abahambayo noma abavakashela amanye ama-countries. Ukhona lento abayibiza ngokuthi motion sickness. Ungabe nje usichazele kancane before sivala.
Oh yes, motion sickness is actually one interesting sickness. It's common kakhulu. Sometimes I think to travel ekuseni. Ngibona abantwana uhamba naye emotweni ngafuna kuhlanda sekafila dizzy abantu. Yendakala if ukuthi into loyibonako nento loyifilayo ayijeli kahle. So bengazi ukuthi you are losing a sense of your stability. Ngayibeka kanjani kufana nokuthi lo munye umuntu lone motion sickness uba nayo nakagibela esikepeni lo munye uba nayo nakayogibela eplane kakhulu ithanza abantu abagibela esikepe, but you also have it kumuntu logibela emotweni nakushisa kwanza ukuthi sakhala ngesisu sakafuna kuhlala. So it's preventable. It's not a big condition, but the condition lengamosha ilona yakho. You find yourself so masakwati kwenda participate kuma itineraries bawabekile for your visit. Sekufana uhlalulele, kufana uhlale hotel. We say kubalekile to get enough air. If ukuthi uya travel eplane nohlushwa motion sickness ungahlali lapho kuhlalela eduze nabo cabin crew.
Okay.
Hlalela eduze nase lapho kutothola gala umoya khona kalula. If usemotweni ngamanye uhlale ku front seat and uhlale emuva. If useplane if usesikepeni ngamanye uhlale ku upper deck and uhlale kulona ku basement or the terminologies. And then uzame thola moya, you can get maphilisi la setawo motion sickness. You can stay hydrated. Lokunye nekudla lokudla kuyacontribute. If you travel like you have to motion sickness, avoid ukudla lokunemafutha, avoid ukudla lokukhozela bo heartburn, like light snack and things like that.
Asibone kakhulu dokotela. Sithemba ukuthi uzophinda usivakashele la kuzempilo zomontakalo. Bayabukela emakhaya. Yingakho lokho yilokho beseniphathele khona namhlanje. Kanti ke ngiyathemba ukuthi nifunde kakhulu namhlanje. Nisale kahle siphinde sibonane futhi next week Saturday ngaso sona lesikhathi 9 o'clock.